Edumedics came about after work that my partner Richard Gosa and I did at the University of Louisville, really looking at employers and their healthcare costs, and they're grappling with the issues of what's causing those costs to continue to rise, and were there programs that could be put in place to really start to address those issues. And so Edumedics came about. It's kind of the belief that if you can combine education and medicine, those two words together, that if you can combine those two and really develop products and services that really meet the needs of the employers and their employees, you may begin to bring about programs that are effective in employee management. Well, healthcare reform has turned an industry upside down. And the healthcare system, along with all those that pay for the healthcare insurance and coverage for their employees, are all grappling with the issue of how to manage and how to work in this new environment.
In the health insurance industry, probably the missing piece right now with most companies out there is the fact that they don't know what the cost drivers are within their health plan. They know they're paying a lot of money. They know the trends in healthcare continue to go up, but they don't really know why. And until you can figure out where those costs are coming from, you don't know how to manage those costs within the plan. There are some studies that we've looked at that show that if you can manage one chronic disease state for one person, that you can actually reduce the cost to the company by about $144,000.
We wrap our one-on-one visits in with education, and that combination seems to make a huge difference for our patients. We had an example of a patient the other day. They had set goals for her first visit to lose some weight and change her diet, and the patient comes back for her follow-up visit, and she's so excited. She's lost 10 pounds, but it's not just the 10-pound change. Her blood pressure went down, and she's impacted her family because now her husband's losing weight too. You're changing their lives, and that's what's critical.
So those are the things I think why it's so important to have a very robust chronic disease management program for employer groups.
Typically, most of the wellness companies, and for that matter the insurance companies, the programs that they utilize to manage chronic disease is telephonic based. From the results that we have seen over the years, that approach is not effective. The approach that Edumedics developed was more of a high-touch, face-to-face intervention with the person with the chronic disease. They establish a relationship with that person, so the face-to-face intervention and the learning associated with that face-to-face intervention is what really sets Edumedics apart.
Everything for us begins and ends with data. On the front end, we're able to take a look at the claims data and look into it in a way that an employer typically isn't able to see. We collect the data then again at the clinical visit through our HealthWord proprietary software. Those two pieces then are married in a report at the end. We couple the clinical data, which shows improvement. We couple the claims data, which shows reduction in healthcare spend, together in a report to show an employer that not only are you improving health, but we can show that we're reducing your healthcare spend. Everybody wins.
There are some disease management programs here, and what they entail are identifying those people that are with those diseases through claims data. Once we identify those people, we reach out to them, ask them if they'd like to be a part of the program here, and if they're agreeable, they are enrolled, they meet with me.
I've lost a total of about 37 pounds in about 18 weeks since I started. I feel a lot better. I mean, I've got more energy. Like I said, the mobility for me was a big thing. And having the convenience factor here, on site at H&B is a huge benefit. I don't have to worry about calling my doctor and going down and seeing him, maybe waiting for a week at a time to get in. And plus, it makes it not only really challenging, but it's rewarding whenever people see you in the hallway and say, hey, you really look good. You've done this and you've done that. But those are really nice perks to have too.
Healthcare is everyone's problem, and it's not unique to any particular city, state, region of the country.
There is unlimited need for disease management and effective disease management.
Edumedics' solution is a solution that is transferable anywhere.
It's exciting, it's challenging, but I think at the end what we're bringing to the community is something that is tangible, economic viability for the community, and I think that's important.